So, good afternoon, everybody. Welcome to this most exciting and most important session of today. Learn everything about the new ART Level 1 registration. I know every one of us, including myself and most of the ART consultants in India, they are in dilemma over various situations. We all know Dr. Nitiz Murdia is co-founder of Indira IVF, but he is an expert member of National ART and Surrogacy, and above all, very good friend of mine and most of the ART consultants. Most importantly, this is his brainchild idea because being a National ART and Surrogacy Board member, everyone used to call him probably and Dr. R.J. Patel and others for various reasons. You know, with every dilemma, they were available a phone call away. And that's why the decision decided is let's make this question answer so that we are here to help each and every one who wants to do the infertility practice. Nitiz, I congratulate you. This is a fantabulous idea, and it's not only the help needed, but I feel this is a gesture of a central board member that they are approachable. They are here to help us and to solve our problems. We are planning probably to come with the queries. Today, we are going to speak strictly those who want to register at level 1. Next, we will come with the level 2, and then we will be coming with the third party as well. Nitiz, to introduce him officially, he's an expert member, as I told you, from the Central Registry. He has many awards, but one of the most prestigious award is Budding Embryologist of the Year, National Gold by the ET Health World National Fertility Award in 2019. Above all, Nitiz, let me tell you, ISAR, our Indian Society of Assisted Reproduction, they are felicitating you in 2 occasions in forthcoming Bhopal conference. One, because to all 3 of you who got selected in the national board, but also we are this time felicitating all the embryologists who has given such 1 million babies along with their clinicians, and you are one of them. So you are receiving 2 awards in Bhopal next weekend. He has a leading team member of 160 embryologists, setting educational program of national and international candidates, implementing accreditation programs and striving for a clinical excellence. He holds strong background in the management and SOP-driven system. He designed training for Indira Fertility Academy, which have trained by now 350 embryology and andrology candidates. Special interest in artificial intelligence, new technology, innovations, quality management, and digitalization in IVF lab. Brought an exceptional technological advancement in Indira IVF with the help of electronic witnessing, automated alarm system, cloud monitoring system, and the QMS dashboards. Nitiz, thank you so much for being a friend of friends. And we are going to do today in a pattern that first we'll have a presentation of a Nitiz, which will be a PowerPoint presentation, which will be addressing many of our queries which are already in mind. Meanwhile, we have received many queries. So if they have not been covered in the lecture, we will address them one by one. And you all are welcome to write in the query box so that we can see and we can read out if the time permits. Thank you. Nitiz, stage is yours.
Thank you very much, Dr. Sunita ma'am, for such a wonderful introduction of the topic as well as of mine. I am really grateful to share this platform with you. And as you rightly said, that there have been a lot of questions coming to me. So I have tried to put everything, in this presentation, try to cover all aspects of queries and questions that people have been having. I have put FAQs also in the end. And if there is more question that you feel that people are putting on the platform and that needs to be answered, we'll be happy to answer them. So just a disclaimer that
just for your information, Nitiz, we have 1,200 gynecologists logged in, showing the amount of interest because it's a peak time of a OPD. And still people have logged in, shows the amount of interest everyone have in this topic, and probably they have many queries in their mind.
Sure. Thank you, ma'am. I would like to welcome all and a very good evening to all of you. And thank you for joining this session. I also wanted large number of people to join this so that I can cover a larger population, because it is very difficult to do physically and go to places and cover a large number of doctors and clinics. So I thought a webinar would be the right way. And thank you, Dr. Sunita ma'am, for publicizing it and making sure that more and more people got to know about this webinar. Just a disclaimer from my side. The views expressed are of my own. So let us look at what a level 1 ART clinic definition, by definition, as defined in the law. So level 1 ART clinic, where only intrauterine insemination procedure is carried out as a part of the treatment. I'm not going to cover level 2 as of now. We'll do a separate webinar for level 2 clinics, as Dr. Sunita Madam also told. So let us just focus on level 1 for the time being. Let us look at what are the staff and equipment requirements for a level 1. For a level 1 clinic, you need minimum of 1 gynecologist, and the gynecologist shall have a medical postgraduate in the gynecology and obstetrics. What is the minimum requirement for equipment? You need to have a microscope, you need to have a centrifuge, and you need to have a refrigerator in your lab. Now, coming to the registration part, so the rule number 15.3 of the Act says that no person shall establish any clinic or bank for undertaking assisted reproductive technology or to render assisted reproductive technology procedures in any form unless such clinics or banks are duly registered under the Act. And for the clinics who are already running, the Act says that every clinic or bank which is conducting assisted reproductive technology partly or exclusively shall, within a period of 60 days from the date of establishment of the National Registry, apply for registration. So there have been some grace period being given by the central government for the same, provided such clinics and banks shall cease to conduct any such counseling or procedures on the expiry of 6 months from the commencement of this Act, which is 25th of January 2022, unless such clinics and bank have applied for registration and is so registered separately, or till such application is disposed of, whichever is earlier. So clinics who were already functioning before this Act and have applied for the registration are okay to function. There have been some delays, which definitely is there, and different state to state things are going slow and fast. But I think it has started in a lot of states that clinics are being inspected, and a lot of states have already issued registration certificate to the clinic and the banks. Let us look at how to apply. So there is a registry which is formed by the central government. It is registry.artsurrogacy.gov.in. You can go to this page. Once you go to this page, something on the right hand side that you see on the top will be displayed. There will be a login option. You click on that login, and on the left hand side at the bottom window, you see 3 different categories. One is the ART clinic, second is the ART bank, and the third is the surrogacy clinic. So you can select what you want to apply for. For right now, since we are concentrating on the ART level 1 clinic, you apply on the first option. As soon as you click on the first option, there is a form that should open up, which you need to fill in the details. The 1 or 2 things that I would just like to highlight is, let me see if I can get a pointer. Yeah. So there have been some confusion, which I heard about the director and the gynecologist being the same or not. So director being an optional position, right? So a gynecologist can act as a director. If the gynecologist and the director is the same, you should write your name here, as well as you should write your name in the gynecologist section also. This is the first thing that you need to be careful about. The second thing is the point number 7. You have to take on A and B only. Don't take on the other part because that is for the level 2 clinic. So this is for the level 1 clinic. It's a very easy form, very simple form to fill in and to tick. Anyone can go and fill this particular form. It's easy and simple. Now let us look at what are the application submissions. So first thing is, what is the fees for this level 1 clinic? So the fee is 50,000. The payment details will be provided to you by the State Health Secretary. You can seek guidance from your local CMO and PCPNDT officers for the payment detail. Normally, when an inspection is done, what all things you should keep it ready in a file. So you should all the staff degrees, including the doctor and any particular person required, which I covered in the staff requirement earlier. You should have all the degrees in the file and the registrations, and you should maintain all the equipment bills, which I again discussed in the earlier slide, that what all equipments are required for a level 1 registration. You should maintain all these in a separate file. The team may come and inspect and ask for evidence of the proof of qualification certificate, registration certificate, equipment bills, and the draft consent forms. The draft consent forms I'll cover in the further slide in this particular presentation. The registration will be granted or rejected. In case if it is rejected, you will be given an opportunity to hear. And your registration will be valid for 5 years. You have to display the registration at a conspicuous place in the clinic, which is visible to the patient. The best place is probably the reception area. And you will need to renew the registration after 5 years. So there will be application and a renewal fees. Any information that you want to go and get into the Act and other things concerned with the Act, you can just go to artsurrogacy.gov.in. So you'll find all requisite details, which any new thing that is released or any new notification, you can find everything here. So let us look at the definition of assisted reproductive technology. It means that all techniques that attempt to obtain a pregnancy by handling of sperm or oocyte outside the human body and transferring the gamete or embryo into a reproductive system of a woman. This is how assisted reproductive technology is defined. What is assisted reproductive technology clinic? Means any premises equipped with requisite facilities and medical practitioner registered with the NMC for carrying out the procedure related to assisted reproductive technology. What is a commissioning couple? A commissioning couple is an infertile married couple who approach an assisted reproductive technology clinic or bank for obtaining the services authorized of the said bank or clinic. There can be single women also who can undergo treatment, provided that she is about 21 years and not more than 50 years. And infertility, of course, everyone knows. Now, let us look at counseling and the consents which are required for a level 1 clinic. So if we go to the clause 21C, it says that you should provide a professional counseling on implication and the chances of success of ART to all your patients. You should inform them advantages, disadvantages, cost, side effect, risk for arriving at an informed decision, which again is a part of the consent forms, which we'll go through later. You should provide the awareness on the rights of the child born through ART, which is the 21D. The 22(1)A says that you should not perform any treatment or procedure without the written informed consent of all the parties seeking assisted reproductive technology. And the 22(4) says that consent may be withdrawn by the patient anytime before the gamete transfer. And namely, the consent form is specified in the 13F. You have to maintain all these consent form. We'll just go through these consent form quickly in the further slide so that you can understand that what form stands for what. So this is a form number 7. So mainly if you're doing IUI with husband semen, you should use this particular form. There is a form number 8. This is for the donor semen. Now, a couple going for a donor semen, you can use this form, or a single lady. If you see this note at the bottom, the appropriate modification in the form may be used for artificial insemination or intrauterine insemination of a single woman with a donor semen. So in case if a single woman is coming to your clinic, you have to use form number 8. Also for a couple who's going for a donor semen, you have to use form number 8. This is the consent for freezing of the sperm. Again, it's a simple thing that it covers for both level 1 and level 2 clinics. But in case of a level 1, you probably have to fill this particular part where it says that in case of a death of a husband, what are the 3 options that the couple would select to? There have been few concerns and queries regarding the renewal of the 1 year. So I would like all of you to draw your attention on this particular point, which says that as long as I have cryopreserved gametes in storage at clinic mentioned above, I hereby agree to contact the above clinic at least annually to provide the current information indicating my address, telephone number, email address, contact number, and intention regarding my cryopreserved gametes. Failure to contact the clinic for a period of 12 months or respond to a request of the information from the clinic within 90 days of the receipt shall constitute amendment and signify my desire to terminate storage of the cryopreserved gamete. Right? So a lot of clinics have this, that what if the patient is not responding? What if there is no response coming from the patient? What do we do with the frozen gamete? So this particular section takes care of that particular part. Also, you can read through the fees and also the third alternate contact and the responsible party which the patient needs to declare is covered by the section number point number 3. This is form number 11, which is specially for minors. You can see form number 11 for minors. So if a boy is, not married and he wants to get his sperm frozen, especially for cancer patients, he can authorize his parent legal guardian and he can get his sperm frozen. Again, the same in case of death, he will have to select these options prior what to do with his sample. And also the renewal provisions is similar way. Point number 1, the same way it is written in the earlier consent. If they don't come to the clinic within the 12-month period, the sample can be discarded. So again, please go through this point number 1, fees point number 2, and failure to pay the fees, which is point number 3, and the alternative or the contact and the responsible party, point number 4. So this particular thing clears that in case if the patient does not respond to the clinic, what can you do with the sample? All this declaration has to be taken before. Now let us look at the clinical aspect. The clause 21A also says that the clinic to determine eligibility of the commissioning couple or a woman. So a woman, the age limit to undergo fertility treatment is 21 to 50. For a man, it is 21 to 55, right? My suggestion, or it's good that you should maintain a copy of the age proof. So normally Aadhaar card or a driving license, wherever the age proof is there, you should maintain that copy with the clinical record. Clinic to obtain donor sperm from the registered bank, that is covered in 21B. In 24C, a woman shall not be treated with sperm derived from more than one man during any one treatment cycle. So only one donor, one recipient. The 24D takes care that clinic shall never mix semen of two individuals for the procedure specified under the Act. The 28.1 takes care of storage of the handling of the gametes. You should ensure security, recording and identification, which I think the clinics follow. You just need to make sure that you have a proper system in place and a proper SOP in place so that this particular aspect is taken care of. The 13A talks about ensure that all unused gametes shall be preserved for use on the same recipient and shall not be used for any other couple or in case a woman. So basically this particular point takes care of the fact that let's say if you're doing an IUI cycle on a particular couple using a donor sample, and if that particular couple is unable to conceive in that particular cycle, you can use the same donor sperm again on the same patient and to do a second or a third or a fourth IUI cycle. The point number 29 takes care that any sale transfer of gamete cannot be done within the country and outside the country. And in case any transfer has to be done, it has to be with the permission of the national board. And there is a set of rules, what all things has to be filled if you want to transfer the sample. Now, this particular aspect takes care of the current practices which used to be there before the law came into picture, where there were a lot of pathological labs doing the semen processing and then moving that sample from the pathology lab to the clinic. This particular thing is not allowed now. Any sample movement from one clinic to other clinic, city to city, even within the city or outside the country, has to be through the approval of the national board. So kindly make sure that nobody of you is doing this particular aspect. Also, there were few gynecologists who were using some other labs or a gynae setup, or I would say level 1 clinic setups, where the semen processing used to happen there, and then the semen sample used to be transferred to the second clinic, and then the IUI insemination used to happen to the second clinic. Again, this thing is not allowed. Just keep one thing in mind, that any sample movement happening anywhere, even within the city, has to be with the permission of the national board. So kindly do not move samples across anywhere. This is one change which I think has come in terms of the practice, which people were doing before the act compared to now, how you will have to align your practice after the act. The point number 27.2 takes care of that. The semen sample has to be obtained from a male from 21 years to 55 years. This is the donor semen sample that I'm talking about. Let us look at information management, right? So the 21E says that the confidentiality has to be maintained for the donor, of course. 21E says that in case of disclosure of information about the treatment, who can you disclose the information to? First is the database of the National Registry, which is getting formed or in the process of getting formed. To the commissioning couple for whom there is a medical emergency, or any order by the court or by the competent jurisdiction, you will have to disclose the information about the treatment. The 21H says that you will have to issue a discharge summary which details the ART procedure performed. The 21J says that information to be provided by the National Registry once the process starts. So you will have to share details of enrollment of the commissioning couple women, the procedures being undertaken, and the outcome of the procedure or any complications if any. The 23B first says that you will have to do an online submission, all the information available with them in regard to the progress of the commissioning couple or woman. So this is when the National Registry comes into place. And the point number 23 takes care of the record keeping. Now the clinics will have to maintain a record for at least 10 years or the closure of the clinic or the bank. In case there is a criminal proceeding, then the record has to be maintained till the disposable or the final closure of the case, and it may extend to more than 10 years. In case of a clinic shuts down, they will have to also send the record to the National Registry, and also after 10 years, you will have to send your records to the National Registry. I also heard a lot of questions on grievance handling or a grievance cell. The law doesn't say about what has to be there in a grievance cell, but I would, if I were to say that how a grievance cell has to be formed, it is basically you can have a 2 to 3 member team in your location who takes care of the grievance management cell. You should display the name and the contact number of the members of the complaint cell in the prominent area, which is at the reception, so the patient can see this. Some of the inspection team, are asking for this particular aspect. And this form number 5, which is the grievance, the complaint to the grievance cell, should be available as a print in your reception, right? So there should be a display of who constitutes, the name of the people, the phone number and the email displayed in a prominent location in your clinic, which forms the grievance cell. And this particular form should be available at the reception for any patient or legal representative or relative or family member or anonymous to put any grievance against any of the treatment done at the clinic. Let us look at offenses and penalty. So the first thing it talks about that you cannot do any advertisement which talks about the sex selection, right? So if anything like that is done, I mean, this aspect is taken care by the PCP entity, but again, this has been enforced in the ART Act. If done, there is imprisonment of 5 to 10 years and a fine of 10 to 25 lakhs or both. There is again offenses and penalty on few aspects. Let me just read through. So if any medical geneticist, gynecologist, registered medical practitioner, or any person shall not abandon, disown, exploit, or cause of abandonment, disowned, or exploit in any form the child or children born through assisted reproductive technology. The second one, sell human gametes, run an agency, a racket, or an organization for selling, purchasing, or trading of human gametes. Third thing, import or help in getting imported in whatsoever manner human gametes. Fourth, exploit the commissioning couple, woman, or the gamete donor in any form. Fifth, sell any human gamete for the purpose of research. Now, this thing has, the first penalty is a financial penalty of 5 to 10 lakhs. If it is repeated again, then subsequently there can be an imprisonment of 3 to 8 years with a fine ranging from 10 to 25 lakhs. There is clause number 37(1), which says that where an offense under this act has been committed by a clinic or a bank, the executive head of the such clinic shall be deemed to be guilty of an offense and shall be liable to be proceeded against and punished accordingly unless he or she proves that the offense was committed without his knowledge or that he has exercised all due diligence to prevent the commissioning of such offense. And there is a point 37(2), which again says that notwithstanding anything contained in section 1, which is this particular section 1, where an offense under this act has been committed by the clinic or the bank and it is proved that the offense has been committed with the consent or connivance of or is attributable to any neglect on the part of any officer other than the executive head of the clinic or the bank, such officer shall also be deemed to be guilty of that offense and shall be liable to be proceeded against and punished accordingly. So the best way is to have SOPs, have training in place so that, and maintain those proofs so that any negligence which happens on the clinic where it cannot be directly attributable to you or you found to be guilty, it has to be proved in court. So it is better that we maintain whatever SOPs you have at your clinic. It should be reviewed regularly. The training given to all your people who are working in your clinic, there has to be a trail which has to be maintained so that you have a proof that you have done sufficient effort from your side to make sure that all the staff working in your clinic is trained, follows a particular SOP. I think I have come to the end of my presentation. I just have put a few questionnaires. There have been a few questions which have been coming before this presentation started. And also I have been hearing a few things on and off here and there. So I just try to put a few Q&A from my side, which is a frequently asked questions. So the first and the most prominent question is, can gynecologists do stimulation without registering for ART level 1 or level 2 clinic, which used to be the practice earlier, that gynecologists used to stimulate a patient and then send to level 1 or level 2 clinic. There has been an RTI filed and a reply came on the 15th of November. which says that no ART procedure in any form can be ART procedure in any form can be performed without being registered under the Act. No ART procedure in any form can be performed without being registered in the Act. So there have been multiple people trying to say the definition and this and that thing, but my particular suggestion in this aspect is I have shown to take a registration for a level 1 ART clinic is very easy. It is better that let's not play with the fire. People who are doing such kind of thing should go for a registration, which is easy and neat and clean better. Let's not play on the interpretation part.
Can I interrupt you here, Nitiz? Let's discuss this point, because many people have asked this query that they are doing a stimulation. It means they are doing a monitoring and they have a PCPNDT registration with them, and they are submitting to PCPNDT every month before 5th of every month their data. Now, suppose actually, to my knowledge, the law is about the RTI. Now, the law says ART1 clinic is the one who is doing a IUI. Now, even if you request the ART1 clinic, the routine clinics who are doing a stimulation, but sending even for a IUI to the IVF center, naturally, if they are not doing semen processing in their clinic, now they cannot take the process sample from any ART center. Obviously, you cannot do the transfer of the gamete from even one building to another building. So they want to send the patient for IUI to the ART center. Now, the thing is, if they wish to register also, when the inspection comes for the ART level 1, you need certain things like centrifuge machine. There is no need of a centrifuge machine for those who are doing just the stimulation. The 3 machineries which you said, there is no need. Second thing is, they don't need to submit any form every month because they are not doing any IUI procedures in the clinic. So my request is to our national expertise is you should be guiding the government, which in the law they mention very clearly that ART level 1 clinic is the clinic who is performing IUI and level 2 is performing ART. Now, these clinics which are doing just the stimulation and monitoring should be registered under PCPNDT, obviously, and they are registered. And there is no need for them to go to the ART level 1 as explained in the law. Because
correct.
What they will submit. So I request you, on the contrary, on behalf of all the gynecologists who don't want to register because they don't want to do IUI in their clinic, on behalf of all of them, that you people should clear it to the government that there is this RTI has caused lot of confusion because no procedure, no ART procedure can be performed without registered.
Correct. So, ma'am, I have raised this issue. I mean, this RTI is of November. I have raised this issue after the first board meeting on the 24th of August 2022 with the central government. But somehow I feel that they are still of the opinion that any particular procedure regarding which leads to IUI or which leads to a IVF has to be done through the registered level 1 and level 2 clinic. That is what even I tried to do it even before this RTI came into picture. I tried to do this thing with the government, but somehow it has been their thought process when they designed this particular law. That any particular ART treatment has to be done at the ART registered center, because at the end of the day, the stimulation is leading to a IUI or IVF. So that has been the narrative as of now for the government.
I'm sorry. I thought I got disconnected. Nitiz, it's a very important thing, and I think you can represent and inform them that stimulation is not a ART procedure. Because according to them, ART procedure means handling of the gamete or manipulation of the gamete or the transfer of those embryos.
That's true. That is what I represented, and that is what I have even showed them, that the definition of the ART is this. But what their thought process was, that we have designed this law so that any fertility treatment which is leading to IUI or IVF has to happen in a registered level 1 or level 2 clinic. I mean, I've done this in August.
Can I ask you, Nitiz, one thing? Then those who are not doing IUI, what is the form they are supposed to submit every year? Nil form.
That's correct. But whatever.
So when they will come for the inspection, if they come for an inspection, they will not see any machineries like incubators or centrifuge machine, and they may say your ART clinic 1 level is not eligible for registration. Then those gynecologists have to stop the stimulations.
True. I can raise it again, but I tried to do that on the 24th of August, but that is what the thought process of the government was when they designed this particular law. Yeah.
So I think it's fair enough that you will be speaking about this RTI and making more clarity with the government, because otherwise these gynecologists are not going to put up anything else than the sonography machine, which is not needed for ART level 1. They have not told about the sonography machine also.
Yeah,
and in fact, they need it.
Yeah, the thought process of the government was that any couple, I mean, why we are doing this registration for the level 1 and level 2 is so that all the couples who require this particular kind of treatment should go to these level 1 or level 2 clinic. That was the thought process of establishing this law, so that any fertility treatment happens in a level 1 or level 2 clinic, and that is how they designed the law. This is what, what I heard when I discussed this particular aspect in the August of 2022. Anyway, let me move to the next FAQ. Again, something that I discussed, that before this law came into picture, that there have been pathology labs who have been processing semen samples and moving to maybe a level 1 clinic or IUI clinic for insemination. Now, this particular thing is not allowed. Any movement that happens of any of the gamete has to be approved by the national board, and the clause number 29 takes care of that particular aspect. There also have been a lot of discussions regarding the self-donor, which some people were not very clear that can it be done. So yes, the self-donor can be done, provided that they do follow the same process of any unknown donor, and it has to be via ART bank. So yes, couple can bring their relative, friend, known, unknown. The only thing that the ART regulation says that the age of the donor has to be between X and Y, right? So there is a defined age for a sperm donor and a oocyte donor. You will just have to follow that particular aspect. The law doesn't mention anything about anonymity, so kindly do not get confused or bothered about that. Anyone who is between that age can donate the semen sample, and he has to be through ART bank. Then there was another thing which says that can a level 1 fertility clinic stimulate females, use gonadotropins and refer them to a level 1 clinic? The answer to that has not been answered as no, but what it says is that as per para 3 of the assisted reproductive technology regulations, only ART level 2 clinics can do surgical retrieval of gamete as well as handling of oocyte outside the human body. And then the next question was, can a gynecologist...
So Nitiz, to clear the doubts in the mind of a people, because there is one query on this also. So when they said they level 2 clinic does this, it means if you are level 1 clinic, please you go ahead, stimulate and send the patient for a egg retrieval or for the ART procedure to level 2.
Mm-hmm.
You can do this if you are registered as a level 1 clinic.
Yeah, I mean, that's what the RTI
They did
also
not say
said.
no. They did not say
Yeah, they
no.
did not say yes. Otherwise, the earlier one they said no. When the question was asked about can a gynecologist do a stimulation, here they said no, ART can be performed. The next question was, can a gynecologist be attached to more than one clinic? Again, there is no restriction on the gynecologist or even the embryologist kept in the act. So, of course, they can. So, ma'am, I think I have come to the end of my presentation. If you have any further questions, we can just discuss. If you think there are more questions other than what I have already covered, we can quickly.
Yeah, there are. So all the chat box questions, let me ask you one by one. There are a few on endometriosis and PCOS. We are not going to discuss, obviously, that. The question number one is, I have filled online form for ART level 1. Where should I submit the offline form with the sign and a stamp?
You will have to find it from the local authorities. Who is the state authority designated for that? You will have to submit to that. Now, a lot of states have made PCPNDT as the ART authority, but there are some states who have made a separate authority for the ART. So you will have to find it locally.
Okay, so it's like either where you go in a PCPNDT office in your local corporate and find out whether it is allowed, or take a information whether the state has given any other. I think most of the places it is the PCPNDT office only.
Correct.
Okay. Do we need to fill form F or form G when we do the, they did not say when, form F or form G, do we need to fill?
Ma'am, I think this is a PCPNDT question, not related to the ART.
Okay. Again, the same was, can we do the ovarian stimulation? We said that. But here again, we insist that Nitiz, you represent to the government and explain them what is stimulation and what is egg retrieval. Now, how to register your clinic for level 2? What is the prerequisite? I think we are going to take the session. Yeah. We will be taking a subsequent session on level 2. So that time we will discuss. Please comment on thin PCOS. No. What is the experience of a ovum pickup in years of experience? Again, in level 2, we will cover that. If the patient sued doctor after failed procedure done, in spite of a written consent, you go to the court, nothing more can be done for that.
Yeah.
How to manage a recurrent endometrium? I think this was not today's topic of discussion. What is the first step for registration under the ART Act? I think you have explained it very well, to go to the website and open up and click wherever you wish to register, either as level 1, level 2, or the bank. We have registered for ART level 1 clinic, but received no information yet from the nodal agencies.
Yeah, so this I have already told that there have been some states who are a bit slower. Some states have done it, but we as a national board has requested the central government to fast track that, and the central government also has discussed this with the state. I think the only two places where I see the state authority not being formed is UP and Bihar. And there have been some states where the state board is not formed. So we have already submitted an email just 2 days back again to the central government that there have been clinics who are facing such issues, and this thing has not been conducted. So kindly pass this information to the state government so they can give the registration as early as possible.
Yeah, and I think they should not become restless. They should continue as per the law, include all the work as per the law. As far as the age of the patients or the couple is concerned, or from where you are procuring the semen or all. Whether clinic where IUI is done, but semen prepared from other lab, in this case, clinic must be ART registered or not. Oh, I think they are confusing. Now the semen cannot be transferred.
Yes, exactly.
So I think this question, I think you made it very clear that the semen sample, now you need to change the way you used to do the practice.
Yeah, the practice needs
What
to
are
be
the rules? What are the rules for IUI insemination with donor? I think you made it very clear: self donor or unknown donor. Even the self donor you wish to take, the provided you send it to the bank which is registered. Let that donor get registered to the national registry, his name, and then that bank will send you his sample. Am I right, Nitiz?
Yeah, I mean, any self donor that you have to route it through the bank. Follow the
Correct.
same process as you would do for an anonymous donor.
So just don't do that in your clinic. If you have to route that through the ART bank. I think the rest of the questions were answered very well in your. No more questions I received, because I think your presentation was excellent. What are the few things, Nitiz, I would like to say is, yes, the way IUI's practice has changed now. Second important thing is, previously it was an anonymous donor, what we used to practice with the ICMR guidelines. Now you can have a known donor, but you have to route through the bank. So I think if we will be taking again third-party reproduction, the things will be little clearer. But what my experience, Nitish, is we are working with the health minister for a stem cell. You know that I'm doing a lot of work in a stem cells, and we had recently 15 days ago the Zoom meeting with the 10 stem cell consultants, and the health minister himself gave 2 hours. We were from ortho, diabetes, neuro, ophthalm, all branches, the stem all the clinicians. And of course, ICMR is putting stringent guidelines, even in stem cells, and he is very open to suggestion and to understand what are the procedures and what are the problems we face. So I think those who are not going to do IUI but wants to do the stimulation even for a IUI purpose, for example, they are not going to do IUI. They may be doing only stimulation and time relationship. So at least still it is a part of a ART. And the thing should be little bit simpler and clearer for them. And I'm sure you all 3 national representatives will help us to reach out to the government and put up across the government. Thank you, Nitiz, and thank you, interns. Wonderful session, and I hope people have got the answer. Is there any, Vishal, site where they can keep on sending the questions still?
No, madam. All will be provided recording.
Madam, they can post the questions on same link, and we will be getting those questions and we will be forwarding to faculties.
Okay. So, Nitish, can we do that? They can keep on sending the questions to the same link. And when we are going to go for a level 2, if any important questions, you can always address them.
Correct. Just a request that whoever puts the question, just put your name and your mobile number also. So in case if we have to do a quick intervention and reach out to you, we can do that also.
That's wonderful. That's wonderful. And can we do this, post it on a YouTube link of any, it may be Indira, it may be Intas, just post it, the link, so that these people can, those who have missed out can go through this presentation later.
Yeah, just to update, madam, this session was live on YouTube, and the recording will be also available in the form of YouTube link. We will be providing that link.
Okay, lovely, Nitish. Thank you so much.
All right, thank you very much, ma'am, for moderating this session and some great inputs from your side. Thank you very much, and I would like to thank all the people who could take out time and join this session. We'll, as ma'am also pointed out, we are planning to do level 2 session. We are planning to do third-party reproduction, and we are also planning to do surrogacy and what are the laws applicable for that. So we'll keep intimating you and keep informing you about when these sessions happen in future. Do get connected, and please keep sending your questions to us. Thank you very much.
Thank you, Nitish. You were wonderful. You were wonderful. Thank you. Thank you.
Thank you, all of you.